Hey, welcome back to Table Talk. Today we're going to talk a little bit about the factors that create dizziness. Typically there are three things. When we're looking at the inner ear, the eyes, and the proprioceptors, which are the little sensors in your body that tell you where you are. So if you close your eyes, you can still touch your nose. Those are those sensors. So they work kind of like a GPS system does, and they triangulate. So you can imagine if you're having an ear infection and it's dark outside, you might be a little bit off center and you might be a little, you might have a tendency to fall. So that does happen, especially as you get older, and you'll actually see that happen more and more with the older population in that case, because again, that triangle, that GPS system is not working properly. So when we're looking at dizziness, a lot of times dizziness is also coming from a condition called BPPV, which is a benign positional vertigo. And that means that there are little crystals in the inner ear. You have these little hair follicles in the inner ear, and sometimes these little crystals called canalus, they sit on the hair follicles and they still tell the body, hey, you're still moving. And so when you turn your head to the right, all of a sudden you get really dizzy because it's still telling you that it's moving, even though you're not. And so that can be, again, an inner ear thing that is something that can be treated. There is a maneuver for that. It's called a half somersault maneuver. I didn't make it up. A doctor from Colorado did. And it's a very good way of doing a home treatment version for this. I'll show you how to do that in just a moment. So a couple of things also with the, you have the inner ear, you have the eyes. So make sure if you need glasses, that you get glasses. And especially at night, you might not have the best visual, so you might need to make sure that you have good lighting so you can get around when you are walking around at night. Another thing is, again, and this is where chiropractic really shines, is those proprioceptors I talked about, where you are in space. A lot of them have to do with where the joints in the neck have tons of proprioceptors that will tell you where you are, as well as the knees, hips, and feet. Those all help you tell you where you are, and so you get a little dizzy again of all three of the systems, eyes, ears, and the proprioceptors. They're not working, that can be a problem. So chiropractic can help out with that one quite a bit. And then again, we can help out with the repositioning those crystals. We do that here in the office, and there's there's maneuvers that we do, but there is a home technique that you can do as well, again called the half somersault maneuver. You can look that up as well, and it's based on the side that you're getting dizzy with. For example, if I'm getting dizzy on the right, then you'll do the half somersault maneuver for a right-sided vertigo, okay? And so on the floor, this is how you would do it. You'd end up, let's go maybe a little bit right here, there we go. So on the floor, if I'm getting dizzy, and I'm getting dizzy to the right, I'm actually gonna take my head down to the floor, and I will turn my head to the right. That is the way that you do this. And you might get a little bit of dizziness, so have a trash can nearby or whatever. But you'll do this about 3 times. So you're going to go take your head all the way down, and I look towards the right side of that knee. So you're going to take your head down like this. You'll then turn your head, and you'll hold that position for about 30 seconds. So you take your head down, hold that position for 30 seconds, and after 30 seconds, you'll come up to the 90 degrees. So you'll come from here up to here, and then I kind of like come back here and kind of walk myself up like this, and I'll kind of keep my eyes closed. That also helps out with the dizziness, and I'll keep looking that way. Nice deep breaths in and out, and then you can repeat this again 2 to 3 times. That does help alleviate some of those dizziness symptoms. It's not a guarantee, but it is a tool out there, and it is very useful to use. So again, half somersault maneuver. If you're getting left-sided vertigo, you would then turn your head to the left and do the same exact thing. Okay? Keep watching us. We're going to keep giving